most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical
Because
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to go over the top 5 reasons you have shoulder, hip, or knee pain at night. We're also going to give you some clues on how to stop that.
Sure.
But tied into this, by the way, is our giveaway. And if you are new to our channel, please go to we're going to grab,
Oh, wow. They got through off there,
You're going to
Bob.
want to go to bobandbrad.com because we have a giveaway section. We're always giving something away. This way, we're giving away the Sleep Evasion mattress. This is only a section of it. We'll talk about it in just a second. You can also find it on Facebook. Short version of us, go to Instagram or Twitter. All
60
right?
seconds, right?
Yeah, 60-second versions of us on that program. All right, we have just a little sampling of the Sleep Evasion mattress. It actually comes with a cover too, obviously, but you can see it's got a little individual mattresses that also allow airflow in between them.
Sure.
What's nice about this is one of the top 5 reasons you're having pain at night could be from your mattress itself. If your mattress is too hard, or if your mattress does not allow to relieve some of the point pressure. By point pressure, like when you lay right on your shoulder, you're getting pressure right on a point. When you lay on your hip, you're getting pressure right on a point. Yep. And when you lay on your knees, you can get pressure right on a point.
Right.
So we're going to show you how this mattress, why we like it, and why we liked it from the start. We're going to bring it right to the edge here. Look how the shoulder sinks in there and it relieves the pressure on that area. Now we're spreading the forces out. We're not getting point pressure right there. It's getting spread out over our area. Same with the hip. It's getting spread out and over an area. Same with the knee, which we can't show right here. But I want to show also, Brad, this is the reason you like it at night, right? When you sleep on your back.
Right. It allows the sacrum to sink in and allows support on your lumbar spine, which I noticed it immediately the first time I laid on the mattress and stuff, but this was a major difference compared to my old mattress, and I was
so
very
rather
happy.
than having a gap here, it sinks in, and he's getting pressure all the way along here. So that's why we call this kind of the pain relieving mattress, and I think it works out really well. But we're going to show you some other things in case you can't get a mattress. If you don't win the mattress, or in case you don't want to buy one,
Sure,
we're going to show you some other things to do that help relieve the pain at night.
We'd call them options, right?
Options.
There
that's
you
right.
go. We're
By
going
the
to take
way,
Sam out of here.
If you do use the link below, you will get money off. Was it stuck?
Yeah.
It will give you money off the mattress for all the Bob and Brad fans. So, by the way, here's the pillow. We're also giving away 2 of those, aren't we?
Right. That's a section of the pillow. There's the full.
You want to talk about that just for
a
second,
the
Brad?
unique thing about these pillows is they have springs inside, and they do have the same design where it has separate little cushions that help relieve pain, but the springs allow for airflow in the middle, so it's a cooler pillow. And the neat thing is, I thought you're going to feel those springs, but you do not. They are really, the way they designed it, they're in there, and you just never know they're in there if you didn't cut it apart.
Okay, so the second reason you might be having pain is because you have poor positioning of the shoulder, hip, or knee when you're sleeping at night. So let's say this is your painful shoulder. If you're laying on your side and you're staying off the shoulder like we told you to, but the shoulder is still internally rotated and turned in and adducted.
So you're talking about this being the sore shoulder?
Yep. This is the sore shoulder. And this is actually how we test for sore shoulders, is we turn them in and internally rotate.
Right, the Hawkins-Kennedy or the crossover, we're trying to provocate pain, and why would you sleep in a position that way?
So in this instance, we're actually going to recommend you're going to use a couple more pillows. I'll just use these 2, Brad.
Yeah.
So you're going to use one right here, and then you're going to use another one right here, and you're going to keep the arm nice and level now.
You don't have a pillow for your head now.
I know. Well,
take it from your wife.
Use your imagination. But yeah, you're going to have to invest in some pillows, and you're going to get it right in the right position like this.
And sometimes I like to put mine.
Get it more in there, right.
This really makes a difference. It's much more comfortable.
Same with the hip. The hip is turning in like this, and the knees are coming together. If they're hurting, they're bumping up together.
Right.
So it's nice to have a pillow between the legs. That levels out the hip, and it takes stress off the knees.
Right.
Now, the final one, we've shown this one many times, but to take stress off the shoulder, let's say you just feel like you're still compelled to sleep on the shoulder that's painful, go ahead and you take another like a throw pillow like this.
Mm-hmm.
You're going to have two pillows, generally two pillows on the side because you don't want your head going like this. You want to have two pillows to fill in this gap.
Right. Right here.
Yep.
And now the canal is formed.
Right. We should name it.
Yeah, I thought we were gonna.
I'll bet you want the Heineck Canal, don't you?
No, Bob. This is your deal. You sleep like this on a regular basis.
Yep, I
don't
sleep
you?
like this every night. I put the pillow here. I lay on this side like this, even though I'm not having shoulder pain. That's why I'm not. because
Prevention.
Prevention, right. And it's just a nice, comfortable position for this. There's not as much stress on the shoulder
Mhm.
when it's in this position. So, again, invest in pillows.
Yeah, or
It's the time to buy.
get them from the kids' bed or whatever. But you need a few.
All right. Third reason you might be having shoulder pain or shoulder, hip, or knee pain at night is just plain old arthritis. And the problem with arthritis is that a lot of times it actually gets worse when it's still. When there's a little bit, when arthritis isn't too bad yet,
Mm-hmm.
you're getting some movement. You're getting your creation of a little bit of fluid.
Right. That
You know.
synovial fluid lubricates, and
Yeah.
it helps feed nutrition to the joint, and so you need motion in a joint. So if it's not severe arthritis,
Right.
you need to keep moving when appropriate.
So that's the problem is that it's going to hurt because it's going to get stiff and painful throughout the night. The only thing
Mhm.
I can recommend is that before you even get out of bed is maybe do a few exercises to help getting things moving. Like this one is a great one, Brad, for the hips and the back actually is to lay on your back like this and just rotate back and forth. Do a few of these, get things, get that fluid going before you
Right.
even get out of bed.
We actually have a couple videos dedicated just on exercises to do before you get out of bed, and they only take a few minutes.
Yeah, and the idea is the same, always to get a little bit of lubricating of the joints going before you get out of bed. Okay, number 4, inflammation. Let's say you got the joints inflamed a little bit, and generally that is you probably overdid it during the day or you did things wrong during the day.
Sure.
And so the only thing we can say is, don't overdo it, or also make sure, like if you're getting impingement at the shoulder, that's a whole different animal. That's a whole different video. But you'd have to watch some of our videos to know what to do so that you don't flare it up.
Right.
So-
Yeah, I've got a patient right now. He's got a partial tear. We're trying to get through without surgery, and it was so inflamed at one point that
You couldn't even do anything.
right, he had to sleep on his back.
Yeah.
Because when he did roll on it, it'd wake him up right away.
And sometimes, you can as simple as maybe using some ice before going to bed
Mhm.
to try to calm it down too. Some people use ibuprofen, if recommended by the doctors.
Right.
So, number 5 is one that we really can't help you with, but you have to keep this in mind. That's why sometimes you need to see your physician. Is if you're having an infection somewhere,
Right.
you're definitely going to feel. Infection is one of those things that often show up at night because you're not doing anything else, and that's your focus right on that pain,
Right.
and it's
right.
not pain that's not going to get better anytime soon.
Right. If you have a joint that hurts, no matter which way you move it, and it's warm and there's some redness, those are 3 good indications. You need to get to the doctor and see if there's something else besides just a strained muscle.
Yeah,
or
very
joint.
good point, Brad, because that's not something you want to mess around with.
Right.
Those little nasty little infections that they have now that seem to be even impervious to drugs. Some of them,
Right.
I mean,
yeah.
they're getting super infections now. So super bugs, I guess they call them, right?
Well,
So
Go on, Bob. I'm not going to touch that.
remember, Brad and I are just not handy.
We're
We're helpful.
This is a premiere ending of a video.
Right.
Good thing most
We can
people
fix
are
just
out,
about anything.
except
A
for
broken
there
heart,
you go.
but we're working on it. Thanks for watching.